Hello everyone. I am Dr. Dhanlaxmi, consultant dermatologist and aesthetic dermatologist, UR Skin Clinic, practicing at Chennai. Today, I am going to give some salient features about vitiligo camouflaging. That is a cosmetic uh, camouflaging. How to work. It is not a surgical, it is a cosmetic camouflage. We are going to discuss. And vitiligo, of course, everybody knows because in olden days it is called Venkushta, that is white skin. But it is a very wrong name given to this. No way it connected to Kushta, leprosy. It is not white leprosy. It is a just discoloration of the skin. That is depigmentation of the skin. Like everybody gets gray hair, that's a white hair. So it is not a diseased hair. When you age, the hair becomes white. Like that, even before aging, our skin becomes white. That's called vitiligo. So the loss of pigment, our melanin stop producing the proper melanin accumulation. That's the melanocytes are radiant. The factory is melanocyte. The factory is somehow, somewhere it is stuck. It is not producing melanin. And so the pigment is not spreading on the skin. So that's why your skin becomes white. So having a white skin no way disturbs your functional activities. So you are otherwise normal. You can lead your normal life. It cannot stop your work. It cannot stop your studies. It cannot stop your eating habits. It does not prone you for any disease. Only then, the vitiligo skin is more over sun damage because you don't have the melanin. So that melanin is the umbrella for the sun rays absorption. So there's no umbrella to protect from the sun rays. So the sunlight can travel inside the skin. It can damage directly to the DNA. So that's why you have to use a proper sunscreen when you have a vitiligo. So applying sunscreen, it cannot hide your skin color. So you need some camouflage. That is camouflage meaning something which hides your original skin. So you have to color the skin to match your normal skin. That's the camouflage. So camouflage in olden days, they do camouflage with this turmeric base they apply. They make it uniform. Then next thing is henna. They apply the henna. They make the skin uniform. So if you have a vitiligo in the tip of fingers, the white skin can be hidden with the henna application. It stains brown to like a mehendi color, no? That gives to it is masking the vitiligo. So there are some leaves that can be extracted and that can be applied on the skin. Some of the things, even our patients used to apply some beetroot juice, some other plant. There is one fruit called like it's a plum-like fruit that also they crush it and then apply on the skin. In the villages, they do it to mask the vitiligo bright whiteness. These are the natural remedies they use it olden days. Even a henna powder can be applied to mask the if the scalp is vitiligo white hairs there, it can be masked with henna application. And other things nowadays in the modern world, there are so many camouflages available. Our makeup artist, they can give you wonderful makeup things to apply on the skin to hide your skin. So you can see so many cine actors and cine actors, they have vitiligo, they have lip vitiligo, they have on skin vitiligo. It all hidden in the picture. Nothing is in there. Looks like normal. Even they make white individual as a dark because for the purpose, and then the dark individuals are white with a good camouflage. But for any ordinary person like people like you and me who work daily, we have to do our what daily morning to evening. We cannot go to the makeup artist to get the thing done. It's not affordable for everybody, but it is needed. Even my cook want to have a project vitiligo. My whoever works with me or whoever travels along with me, they want to have a class. They ask for that. Even a student who goes to the class, a fifth standard student, first standard student, they want a camouflage. How to go with that? So there are some easily available camouflage. We have some particular brand things and particular ingredients to camouflage the vitiligo. So we tell them actually where it is we have to identify. If it is on the tip of the fingers, different camouflage. If it is on the lip, it is different camouflage. First thing, criteria is it should not be toxic to skin, even if it is consumed inside. We can apply it on the skin. Should not give any allergy. That's the thing. Should not be toxic. It should not be allergic to the skin. In long run, it should not do any harm to the skin. And the last thing, it should be affordable to every patient. So it is the main thing. So first we assess the patient, how much they can afford, how they can carry out. So most of the camouflage, when it is applied, it is not disturbed by water or by washing or by regular work. Some of the people, they work in the wet areas, it is washed out. So that also to be taken care. So we have to apply along with that, so that we select the ingredient, we select the area and how to apply. It should be applied on the clean surface and it should be applied desirable quantity. And we always demonstrate in our consultation room with the small kit we have for the thing, which should color match. Each individual is a different color. It looks, everybody is looking same, but each shade is different. So we have to select a shade. That is also important. We have a small sample box, like a small quantity of each color we have. So we have to identify the shade number. Then we prescribe to the patient. There are particular areas, but it's not purely cosmetic. It is actually some shops, they have the dermatologists, which we direct them to go there and to purchase the product. And we match it and we identify the color, we tell them to go there. This is one way. This topically applied creams, lotions, and who do the wet work, who go out with the sweat, with the rain, they need some fixing agents on the camouflage. It's a fixing agent also, it is available in the particular products and particular shops. So that also we guide them to apply. So it's especially very important for celebrity giving some program in the stage or even a marriage or some functions. They want to look better. They have patches on the skin, vitiligo patches on the neck, on the exposed areas. To some extent, they can hide with the clothing, but not all the area. So they want to make it uniform shade. So that and all we help them to apply and to have a uniform looking skin. That's the dermatology is this there. And of course, there are so many things available in the other medias also, they give it. So the one thing the parents should be careful of it. It may be cheap, it may be easy to buy, but how to use your skin, which shade is matching and all, only the dermatologist can help you to find out those things. But good makeup artists can guide you. I think makeup artists are more costlier to afford than the dermatologist. So the dermatologist will give you treatment for the vitiligo as well as camouflage. You are on treatment with me for some months. It takes more 6 months, 1 year, 2 years to get some improvement, some pigmentation. Till that, we cannot go like that outside. So it will be very socially, it does very much impact on the patient thing. They don't feel, they have a complex. They feel very inferior about their skin. So we have to help them out, how to guide it, how to confidently face the common people, as well as when they do something on the stage, when they give a speech, when they do some program, when they go to school, when they go to interview, when they go to some job like that. Definitely it have an impact when they make the skin uniform. So I wish you all happy camouflaging when you have vitiligo. And also I advise you to see your dermatologist to get the proper treatment for the treatment of the vitiligo also, to get back your permanent vitiligo pigmentation. That also important. Only camouflaging is not possible for a long time. But once some of the vitiligos like acral pigmentation, segmental depigmentation were very difficult to improve. After treating all the areas, some of the areas left over can go for the camouflaging. That is medical camouflaging. There is another camouflage available. These are creams, lotions, and conditioning, fixing agents. Another thing is tattoo. We do some matching dyes tattoo on the skin, especially in the lips. Because camouflaging is difficult, we do tattoo. Matching color, we tattoo on the skin, like lips, on the visible areas we do. That has more longer time. We can be it for almost a year or two. It stays there. If you're lucky, it stays there for some 5 years also. It just depends upon the. But everything, the color also fades. Then again, we have to be tattoo. It is according to the patient's condition, lifestyle, affordability, the dermatologist decide on the exact procedure of that. On surgical hemorrhaging, of course, they do differently. That is not advisable most of the time. Vitiligo skin is already there and building damage to that. And we do grafting and melanocyte non-culture grafting, all those things. Those are all surgical things. That takes long time. It is, of course, it's step-by-step procedure. It is not a one day. Easy hemorrhaging is with the creams of those things for a function, for a time gain. It's for a one day. Till you wash your face, till you wet your area, like that. Thank you. I hope this give you some ideas about it. We'll discuss further in next further videos.
For more such videos, visit or log into dermavidya.com.